Hi, and welcome to Safe Environment, the Skin Integrity and Wound Care. I'm Professor Kusarovi. Today we're going to be reviewing anatomy and physiology of the skin. We're going to discuss a little bit of the healing process. We're going to identify factors that affect wound healing, assessment and documentation of the wounds, identify various dressings for wound care, patient and caregiver education, patients that are at risk for pressure injuries, staging of pressure injuries, and the interventions that nurses can do to help prevent. And this will happen throughout the course, this 15-week course on the integumentary system. We're going to review the anatomy and physiology of the skin in this lecture. We have three layers. We have the epidermis, dermis, and subcutaneous or hypodermis. Within each layer, there are various items that are contained. We have nerve endings, the hair shaft. We have veins and arteries. We have our sweat glands, our blood and lymph vessels, our hair follicles, the nerve fibers, the erector pili muscle, and then we have the different layers, the stratum corneum, the pigment ligament, the stratum germinatum, stratum spinosum, stratum basale. Our sebaceous glands are all involved in our skin. Some facts about our skin: it accounts for approximately 15% of our total body weight. It is the largest organ in the body. It protects from external insults. Some pathologies for the skin include inflammatory disorders, mechanical and thermal injuries, infectious diseases, benign and malignant tumors. Within the layers of the skin, the epidermis has distinct cell layers, and these are labeled from the deep to the superficial. Your stratum basale is a single cell layer. Your stratum spinosum is 5 to 15 cells thick. Your stratum granulare is from 1 to 3 cells thick, and your stratum corneum is from 5 to 10 cells thick. The stratum lucidium is the innermost layer of the stratum corneum, and it's found on the palms and of your hands and soles of your feet. 90 to 95% of the epithelial cells are ectodermally derived keratinocytes. 5 to 10% of epidermal cells are non-keratinocytes, and those include your Langerhans cells, melanocytes, the Merkel cells, and your sweat glands. In the dermis layer, it's compressible. It's your elastic connective tissue. It supports and protects the epidermis. The fibroblasts are the fundamental cells of the dermal layer, and it contains collagen. The subcutaneous layer is your adipose tissue or your fatty tissue layer. It helps in thermoregulation, it insulates, it stores energy, and it protects us from mechanical injuries.